Good afternoon, everybody. It's Wynn Brown on Thursday, October 15th with a special COVID-19 update for all the Haywood family and specifically Haywood Hospital family. We have a situation that has begun evolving on our Jerry Psych unit yesterday, and so we want to make sure that everybody is aware of what's going on. It stems from a patient that we discharged last week from our Jerry Psych unit to a long-term care facility. That patient, upon discharge and during the course of stay, had tested negative, but a week after arrival at the long-term care facility, that patient tested positive. The long-term care facility let us know that. We're not sure if that patient picked up COVID-19 at that facility or at Haywood, so the first thing that we did is we subsequently tested all the staff and all the patients on GPU to make sure that we knew if there was anybody who was positive for COVID-19. As it turns out, there was one staff person who had actually not worked the prior week at all who tested positive, and one patient. That patient was immediately transferred to our ICU simply because that's where the bed was available, not because they had an acuity. Both of these, the patient and the staff, were asymptomatic, and that staff person has not yet returned to work per our protocol. Yesterday we had a GPU patient preparing to discharge to a long-term care facility, and per our protocol we tested that patient before discharge, and that patient came up positive. So we immediately transferred that patient to walk-ins to an isolation room. Subsequently, out of an abundance of caution, we retested all 19 GPU patients and the majority of the unit's staff, those who could come in or were already working, and to make sure that we had a handle on if there was anybody else positive. Turns out that 2 additional patients and 2 staff were tested positive. Those patients were immediately transferred to walk-ins 1, and the staff are quarantined at home. It's important to note that all 4 of these individuals, the 2 staff and the 2 patients, were all asymptomatic. So the GPU continues to be closed to new patients, and we have limited its access and interaction with the rest of the hospital and personnel. So we are also UV disinfecting all rooms in the unit daily, and we are delivering meals for staff to the unit as well so that they can limit their interaction outside the unit. The family members of the GPU patients are being regularly informed on the status of the unit and the health of their loved ones to make sure that they know what is also going on. All GPU patients starting today will be tested over the next 5 days daily for COVID-19, and staff will be tested every other day. If a staff member wants to be tested daily, they can be, and we will obviously honor that and make sure that that is available to them. These and other infection prevention measures have been undertaken under the guidance of our infection control team and the Massachusetts Department of Public Health, who is fully aware of this situation. As always, throughout the hospital, visitors are required to wear masks at all times, and visitors to patient rooms must continue to wear their masks inside patient rooms when they are visiting. Additionally, at this time, visitors should not bring or cannot bring any food or drinks into our facilities as well. So we're going to be monitoring that at the doors. So at this point in time, really, staff are reminded to remain hyper vigilant, to include wearing appropriate mask wearing protocol, regular hand washing, and adhering to social distancing and maximum capacity guidelines in our break rooms. And if you've been following some of the data around the state and in our region, we are also seeing an uptick in COVID-19 activity in our region where we have subsequently been low. Remember, we have not, prior to this week, had a COVID positive patient in the hospital for 2 months. We do have one other patient who is positive for COVID-19, the community-acquired COVID-19, also in Haywood right now. So please keep all this in mind and make sure that the safety of our patients and your colleagues are #1 priority for us. I'll continue to keep you informed as the situation evolves. Hopefully we have it well under control right now, but again, this virus is somewhat difficult to manage, as we know, because we're in the middle of a pandemic, but we're going to do everything we can to support our staff and keep our patients safe. And I thank you for all you're doing to care for the community as we continue our journey to be one of the best community-owned health systems in America.